So I wanted to start doing some videos again. The last one I posted was 2.5 years ago, which I'm very sorry about if anyone was watching and waiting. I want to do a little recap of where I was then to now, since a lot of time has passed. The last video I did, I had just begun my Humira injections. I was on those for 6 months about before I switched to Remicade. I had also changed doctors. Let's see, I started Remicade and Imuron together. I was on those for a year. I had some improvement. I was still having a lot of pain. My scopes had showed stricture, ulcers, that type of thing. So I had gone to the ER and got admitted by my doctor for a few days, and they had brought up the idea of surgery to me. I had met with a surgeon in the hospital. My GI doctor didn't think it was smart at the time to have surgery, so I put that off and went an entire year, which I, looking back, should not have done. Anyway, I ended up having surgery a year ago. This April would be a year. You probably can't see, I had about a foot removed of the end of my small bowel to the beginning of my large intestine. You're not going to really be able to see. It was done laparoscopically, so that like tiny little dot right there, that's the scar. They went in through my belly button as well, and then I have a larger scar, they call it a bikini scar, about here, which obviously I'm not going to show that one, but that's where they take everything out of. So recovery was hard. I had some complications after surgery due to being on prednisone. Even though I had been on it at least 6 months prior to surgery, it still affected my body. They said that since surgery is trauma to your body and you naturally produce some cortisone or cortisol, I'm not sure which one, that being on the prednisone basically messed with my body's natural ability to produce any. So I wasn't producing any at all, and it caused fever, a high white count, that type of thing. And so my 2 to 3 day stay turned into 5. And then, so I noticed with surgery that the area that they removed, it didn't hurt anymore to the touch. But once the surgical pain started to fade, I was still having a lot of pain and tenderness. It was a little bit higher than what it used to be. So I landed in the ER again, saw my doctor, and they did a scope, and it showed a small ulceration at the surgical site. I told my doctor that I felt Remicade should have been doing more for me, and that shouldn't, I shouldn't be having disease activity 6 weeks out of surgery. So I switched to Cimzia, which is an injection that you do at home, and also just stayed on the Imuran with that. For me, the Imuran doesn't do anything for my Crohn's. It just helps to prevent the antibodies that you can build up to the biologic medicine. So I've been on Cimzia since September of last year. I've had some hiccups with it just because we also ended up moving from South Carolina to Texas. I lost my health insurance, didn't have a doctor, all that fun stuff. I didn't miss my doses of Cimzia. There was one time I only had 1 injection and I'm supposed to do 2. But I got back on track with everything. I think one of the biggest differences from my last video is that I finally got health insurance, which, as you know, helps quite a deal when dealing with chronic illness. So I actually had my Cimzia injection is due today. I went and did my shopping, my errands, stuff I needed to do because it makes me tired and kind of like you're coming down with the flu-like symptoms. That's what I get with it. So I not only wanted to do an update, I wanted to actually do my Cimzia injection so that anybody who's on it, thinking about going on it, has to start it, can kind of see how it's done. I take 2 pre-filled syringes once a month. Come in the box. I've taken them out of the refrigerator 30 to 45 minutes to make them room temperature. For me, Humira was very painful, not the injection, but the actual medication going in. It burns. It's like a mixture of this icy, searing hot. I know it's strange to describe, but Humira was not very fun for me. So you have these 2. wash your hands, which I already did, got everything kind of set up. You get your alcohol swabs. Now these can be done like Humira, either in the stomach or the top of the thighs. I am trying to make sure I alternate between them every month. It just helps so you don't build up scar tissue when you're not injecting into the same site. So I did legs last time. This time it's going to be stomach. Bear with me through these injections. The actual medicine is very thick. So if you were to just push the plunger down, for me, you get like this tingly shock-like pain, but if you go slow with it, it doesn't really hurt all that much. It's slight discomfort, if any. So I'm gonna do one on each side. You wanna make sure you stay, a few inches away from your belly button. Also, I know it can be hard to tell, make sure that you're not injecting into a vein, if you can try to see any. So I'm going to swab the area. I kind of just make it a little bit wide with the alcohol swab just because I don't know exactly where I'm going to end up. Sometimes I have a little bit of an issue with not getting the needle in right away. I know you're supposed to, pinch some fat before the needle goes in, which can be a little difficult for me to get a good pinch of that. Also, so you're gonna obviously want to check the expiration date. Mine is good for an entire year. Put it upside down. You're gonna see a little air bubble at the top where there isn't any medicine. So you're gonna want to push that out just until you see a drop or two come out. Make sure, obviously don't push too much out. You're not gonna get your medication. And it's very, very expensive, as you know. So I also make sure that the needle tip, you're going to put it in on an angle. The needles are beveled, so if you're putting it in the opposite way that the needle is pointing, it's going to be more painful for you. So you're going to take a pinch of fat. Sorry, I know there's a glare. It doesn't help, but I'm extremely pale. I think I'm glowing on the camera. So you're going to take a pinch of fat the best you can. The needle at about 45-degree angle. I always get a bit of resistance, and there it goes. Till it's flush with your skin, let go of the pinched fat, and inject. Once again, I'm sorry if it's going to take a little while, like I said, to get the injection in. Just check to make sure. I have a tendency to, if I'm not watching too carefully, I pull the syringe back. So you want to make sure the needle is staying in there and that you're also not losing any medication out of the injection site. I've also had that happen. Trying to go as fast as I can while making sure I'm not too uncomfortable, and once again making sure the medicine is actually going where it needs to go. So you'll know when it's all the way in because you can see the gray bottom of the plunger being all the way down. So that's in. Pull it out. Whoop. I don't think I've ever, excuse me while I get a tissue. Sorry, that might not be the best experience to share. I've never had that much blood before. Could have been close to a vein, like I said, that you're not supposed to hit, which is also hard to see if you're not very prominent on you. So, the first time I did have my injections, I bled a little bit. I did them in my legs. When you do, if you are to pat with a tissue, don't push too hard against it because you can actually make the medicine come out. Your handy dandy band-aids. I've been searching for Batman band-aids forever. Could not find them. Finally, which I'm assuming is due to the movie being out, which I have not seen, got my Batman band-aids. Like a true adult. So whichever way, up, down, doesn't matter. Let's see what the insight was. I think that's it. And I think I did hit a vein. I can already see a little bit of bruising. That's normal. For me, I also end up getting, I don't get red and irritated, but I can actually see, I think it's some medicine pooling under the skin, which is totally normal. I get I'd say over the next 24 hours, I'll get a lump you know, it's significant, maybe the size of a quarter, and it's actually a different color than the rest of my skin. It looks a little bit wider, and I think it's just the medicine sitting under there, but obviously if you have more of a reaction, any allergic type stuff, itching, too much swelling where it's uncomfortable, or you even think that something is wrong, call your doctor immediately. So the other side, same with the swab. Give it a second to dry. While you do that, check the needle, check the date. Same as the other, good for a year. Pull the plunger off. Let the air bubble come to the top. It's coming. You might need to give it a tiny, tiny little push to get it up there. Slightly press the plunger. Okay, all the air is out. Grab a pinch. Trying to see for a vein. I still can't. My top of the thighs are actually easier for me to spot a vein. So my stomach, I just hope it's going right. Take another pinch. Again, make sure the needle edge is the correct way. There we go. For me, honestly, I think the worst part of this shot is just getting the needle in. And sometimes, I don't know why this happens, or if it's just me or anyone else out there that's on Cimzia. Sometimes, while injecting, I can actually see like a bubble under my skin. I'm assuming it's just the medication. So this one also, it's going to take another minute. Yeah, just go at a comfortable pace. And try to just rush it to get it over with if it's uncomfortable. If you even need to stop, you know, don't take the needle out, but just give yourself a second. You know, other than obviously the purpose of this video, and you know, I try to, if I'm watching TV, something like that while I'm doing it, just to distract myself while I'm injecting, since it takes a little bit of time. You know, just, you know, every few seconds checking down, because you know, I'm good with IVs, and I've been giving myself injections for a long time, and it doesn't bother me, but with this, since it takes a long time, I think it's just the aspect of staring at the needle on me for a long time. Sometimes I can get a little queasy. Like right now during this, I kind of get like this whole hot flash sweat thing going. Okay, that one's not bleeding too badly at all. Again, the Band-Aid. And that is it. I got, let's see, the first set, hold on one second. So, yep, that's it, that's done. That's all I have to do. Dispose of your needles in the correct sharps container, as always. I got one from the company, white Cimzia plastic container for sharps. And then after that, just from filling at my pharmacy, I've gotten like just a normal red sharps container that you can get anywhere. I called my pharmacy to make sure, you always want to dispose of them properly, obviously don't just throw them in the trash, even the sharps container. I called my pharmacy, they told me that the only thing I can do with them is bring them to my doctor's office. The one that did come with Cimzia, I know they have like a mail back thing. When you get the sharps container, they'll give you a paper, then you call the number, and they send you a box, and you don't have to pay for postage or anything like that, and you can send it back to them for free. Don't know where mine went, of course. Might call them to see if I can send that one back, because I know that if you look for like the laws and guidelines, at least when I looked it up, you have to pay for sharps disposal if you want to mail them somewhere, which I don't think is quite, I don't know, everything costs something, but like we don't have enough financial difficulty to deal with. It's just one more thing, bring them to your doctor's office, that's all you need to do. So that's my Cimzia injection. I will have one in 4 weeks from now. I need to talk to my doctor about possibly increasing the dosage. I believe that you can go up to twice a month instead of once a month. I'm still having symptoms even while being on the Cimzia. I recently had a lovely colonoscopy done, and it showed that the ulceration that was at that surgical site, when you compare the pictures from the 6 weeks after surgery to now, it's clearly worse, but my doctor said it's not, specifically it's not in the small intestine, it's not in the large, it's directly where they were reconnected at the surgical site during surgery. So there's no narrowing. I don't have a stricture as of yet. My worry obviously would be that the ulcer, it's going to be a continual thing of being raw and then healing and then scar tissue, and that's what causes the stricture, is the buildup of the scar tissue. Medicine can't help that. Sometimes they dilate them. I don't want to end up to the point where I'm back to where I was before and obviously needing surgery, but for me, it's just, I'm a little, annoyed at this point that all of this is still happening, and even without the stricture, it's still just as painful. That area of my abdomen, it hurts a lot, to the touch, eating, regardless of what I eat, even not eating for days, doing the whole colonoscopy prep at the area, it always hurts because of the ulcer. I do need to get the pill camera done, so I'm working on that, so it can take pictures, because obviously a large portion of your small intestine can't be accessed through scopes, either upper or lower. So that you'll swallow the pill camera. I have to do a test one first, where you swallow the trial one. It dissolves after about 30 hours. Get an x-ray done at hour 28 to see exactly where it is, because you don't want to do the real pill camera if you have a stricture, because if it gets stuck, guess what? They have to go in and get it surgically. So I need to do that, and I also want to get the MRI and enterography, the lovely barium contrast that you have to drink like a gallon of and then go sit in the loudest MRI machine for like an hour. But I am actually also in between doctors at the moment. Well, I still have my old GI, I just don't feel that the treatment plan is where it needs to be, and might be a little out of his depth with my issues. Don't feel like they're being addressed as much. So always, if you ever feel that way and you're not getting anywhere with your doctor, don't be afraid to find a new one. What I did, since my insurance in Texas, you can only have HMO, which is a pain in the butt compared to what I was used to before, because you have to go to your primary care doctor for everything and get a referral, and all that nonsense. And so I basically looked at what was in network. I had like 128 doctors, but what I ended up doing was going to the Crohn's and Colitis Foundation of America, their website, looked for gastro doctors in my area. Now, they even tell you, I was trying to figure out exactly what goes into their doctors being listed on that website. I think it might just be, I don't know if it's a money aspect, but basically them being on there doesn't mean that they're like the most amazing doctor for Crohn's, or even that they're like have a subspecialty in it. They might not. They might just be a part of the association. But I did find 2 doctors that were listed on their site that matched my insurance, and they have subspecialties in inflammatory bowel disease. Lots of papers published, so just make sure you're getting the care you need to get. I'm going on almost 20 minutes of this video, so I'm going to try to wrap it up right now. Like I said, I apologize for being gone for 2.5 years if anyone was still looking to see a video. Don't want to make the empty promise of saying I'm going to do them again, but I'm going to try to. I don't know if I need to do more injections, if that one's fine or whatnot, but just, keep up with my progress. If anyone has questions or comments or anything they want me to cover, please, please, please leave in the comments section of the video to tell me, and I'll absolutely answer anything or, topics that you want to talk about. So thank you. Bye.